Our second project was looking at people who have learning disability and was led by Professor Mary McCarran from Trinity College Dublin, who's an international expert in that field, and Dr. Karen Ryan, who is a clinical associate professor from UCD and is also the national clinical lead on palliative care here in Ireland. This project was linked to a much wider project called TILDA, which is a longitudinal ageing study, because we know that people with learning disability are living longer, but because of that are then presenting with illnesses for which palliative care may be appropriate. We also know that people with learning disability may not necessarily be able to access the services that they require in active treatment because of a misplaced understanding of the reality of living with learning disability, the ability to understand what's happening, and also place of care, because some of the patients who have learning disability may not live in the family home but may live in a residential care setting. This second project used interviews with healthcare professionals of people who had cared for people with learning disability to try to understand the complex nature of care. The final outcome of that is that we still lack the skills and abilities to understand the experience of living and dying for people with learning disability. There is certainly going to be further work in this, because Professor McCarran has already taken the work of this study further in terms of looking at what supports are needed and how we can train people better to be able to provide the supports that's warranted for people who have learning disability.